Okay, now I'm going to demonstrate how to administer an enema. So first, I'm going to check for an order for an enema for my patient. I'm also going to go through my patient rights, right med, right dose, right patient, right route, right time, and right documentation. So first I'm going to have the patient lay on his or her left side, and I'm going to have them pull their right knee up as far as they can. And then I put my QD on my water bottle. So then I'm going to, I'm also going to make sure it's the right patient, so I'm going to have them state their name and date of birth and check their armband. I'm going to educate the patient as to why we're doing this, and I'm also going to tell them before we start that once I've inserted all of the solution, that they need to hold it in for as long as they possibly can. Okay, so I'm going to get started. I've checked all of my rights, made sure it's the right patient, and I'm going to wash my hands and put on a pair of gloves. So again, we're going to educate the patient as to why we're doing this, and they need to hold it for as long as they can. So I am going to first squeeze all the air out and hold over my sink. Okay, I'm going to squeeze all the air out, and then I am going to put lubrication on the enema. And I don't have any, but I'm just going to state that I did that. So I'm going to keep the enema bottle compressed, and I am going to insert the bottle into the anus. So I'm going to keep it squeezed too so no air comes back in. So I'm going to start. And I'm going to ask my patient if they're okay. Oops. Okay, my cutie fell off, but pretend it's still there. So after I've distributed it, again, I'm going to remind them to hold it for as long as they can until they feel like they're about to explode. Maybe not explode, but until I can't hold it any longer. And then if they are mobile, I'm going to make sure I have either a commode next to them, or make sure we don't have any obstacles, or we have enough time to make it to the bathroom. We're going to make sure we have a bunch of blue pads underneath the patient just in case anything happens. If they're immobile, we'll get like a bedpan ready. Just in case, or just for them to be able to eliminate. And then I'm going to document everything and document their output, things like that. And before I leave the room, I make sure they have their call lights and they don't need anything else from me.